Welcome to Tuesday Tips. My name is Pam Dunwald, and I am one of your nurse advocates from Your Nurse Advocates Consulting. So today we are going to talk about our aging adults, Social Security, collecting Social Security of Medicare age. What do you do when you move to a different state? What does that all entail? How does that work? What are some of the things you need to do if you're caring for an aging loved one that is maybe moving in with you or moving to another state and you're helping facilitate that? What do you need to know that you might not think of? So that's what tonight's topic is for Tuesday Tips. So let's go ahead and jump in. Welcome to this episode of Tuesday Tips. We're going to where we break down important topics to help you and your aging loved ones thrive. So making a move to a new state can really feel overwhelming, especially if you're managing healthcare for yourself or an aging loved one. We've got Medicare, Social Security, doctors. Maybe you're already receiving some kind of aging services in the state that you're at. There's a lot to think about, right? But don't worry, we've got you covered. So we're going to talk about it, and hopefully we'll be able to share some details with you that'll make that a little bit easier for you. So today we're going to talk about navigating the move. And it can seem really overwhelming, especially if you're if you're new to the state and you don't know what a lot of the resources are where you're moving to. So by the end of this live session, you'll have some practical tips for transferring, your benefits, finding new providers, and making sure the care of your aging loved ones stays uninterrupted. So stick with me. Feel free to ask any questions, put the comments in as we go along, and we'll be sure to answer them. And if we're also interested in, if you have helped an aging loved one move and you have any words of wisdom, please go ahead and share that. Our listeners and our community would love to hear some tips and strategies from everyone and how that transition was made a little bit easier. So have you or someone you know made a move recently? What was the trickiest part? Share that in the comments. And when we get started, we're going to talk about 4 key points to cover. But before we do that, I want to give you an example. I want to share a story about a client of ours. And hi, Mavis. I just want to say thanks for giving us the thumbs up. And so I want to share a story with you. So we got a client. It was a friend of a friend here in Wisconsin, and their mom was living in Florida, and she was moving. She was on a cruise, got hurt, ended up having to move to another state. And where she was moving to, this was kind of a spur of the moment. It wasn't a planned move. Now, obviously, if your loved one is moving to a different state, we would hope, best case scenario, is that it's a planned move so you can take care of all the things on the front end. But in this case, they were very overwhelmed. She was receiving some emergent medical care. And so family was very overwhelmed on how to manage the move because the move had already taken place. And so first thing we needed to do is we needed to look at what kind of healthcare coverage did that aging loved one had. And she had a Medicare Advantage plan. And we're going to talk a little bit about the challenges with a Medicare Advantage plan because it's like an insurance, and it is Medicare benefits managed by an insurance company. And most of those Medicare Advantage plans are very regional, which means if you have a Medicare Advantage plan in Texas and you move to Illinois, that Medicare Advantage plan is most likely not going to follow with you. So with a lot of healthcare challenges coming up with an injury, we had to work fast. Fortunately, she had a national insurance Medicare Advantage plan, so it was easy for us. We were able to advise and consult with the family that they just had to go ahead and call her healthcare provider Medicare Advantage plan up and ask them to switch from Florida to the state that she was going to. So that made that part a little bit easier. So we're going to talk about that. Some of the other things is now if she had medications that needed refills. Well, the surgeon that provided her surgery to treat her injury was not going to order her routine medications. And so she needed to find a primary care provider to be able to order and renew those prescriptions. So that was another headache. She was very much following her injury. She needed help in the home. Where do they go? The family was like, who do we go to? How do we find someone to help me? I work from home, but I still have to work. So, I'm going to need some help managing the care for my mom. So we were able to set that up for them. And so, we eventually got her into an independent apartment where she has some services. It's a continuum community, which means you can go from independence to assisted living to skilled to nursing level care all in the same campus. And so we were able to get that all set up and attended doctor's appointments with her. So helped with that transition. And now very happy to say that they're in a place now where the family feels that they can handle things, but they know that I'm only a phone call away and they could reinstate our services at any time that they feel is needed. So sometimes that's an example too of how we just come in and like do a task or we put a plan together and then we exit. So, or other times, we have families that are on our monthly program, our Your Nurse Advocate Now program, which is just, you can do 1 or 2 check-ins a month. You can use that for us to attend a doctor appointment with you, or just to stay on top of, chronic health conditions. So lots of things that we can do that are tailored to your needs. So let's go ahead and let's jump into the 4 things that we want to think about when we're moving. Okay, so the first key point is transferring Medicare coverage. So I'm going to go ahead and I'm going to share my screen here, and let's see, which is yeah, so actually the Social Security one is coming up first. So I'm going to share my screen here. And what we want to do is we want to make sure, especially with Social Security, if you're getting a Social Security check, you are probably doing a direct deposit. And so here, right on the Social Security website, you can sign up to be able to access all your benefits, everything online. And there's a place where you can go ahead and update your direct deposit. So it's something that you can do easy. If your aging loved one is not real tech savvy, my mom is not, my mother-in-law was not. So they may need a little help doing this, but this can also help you be able to help manage their benefits and their health care, even if you're, even living long distance from them. So this is something that is truly a benefit because you can go right ahead and update that direct deposit. So, that's the big thing there with your Social Security. And now to go ahead, and I'm going to switch screens here, and I'm going to go ahead and I'm going to share the Medicare site. And so this is, welcome to Medicare. So one of the things that's really great is obviously, if you have a straight Medicare plan, you just have to let Medicare know that you've had a change in address. If you have a Medicare supplement plan that works along with your straight Medicare plan, well, you're going to have to let them know about your change in address as well. We're going to talk about Medicare Advantage plans in a minute, but the Medicare site gives you a lot of good things. You can help you find providers in your area, find health and drug plans. If you don't know where to go and you don't know, you're in a new place, you don't know an agent, you can ask around. If you know anyone, if you don't know anyone, this is a great place to start looking because it's a Medicare, it's a government site, so you know that you're getting correct information. And so this is a great place to go to if you need to be moving and you're needing to look for new plans. So those 2 websites are a great place to start when you are thinking about moving and keeping all your ducks in a row, so to speak. So the good news, as we said, when you have original straight Medicare, Part A and Part B, those are federal programs, which means you don't need to reapply when moving to states. However, you do need, as we mentioned before, update your address with Social Security so there's no delay in benefits. And also don't forget to change your direct deposit. So here's where it gets a bit tricky as we were talking with Medicare Advantage plans or Part D prescription plans, because those most likely are regional. So your current plan may not work in your new state. So these plans are offered by private insurance companies and they have networks tied to specific regions. And so even with our example of our client that moved to another state, she kept the same Advantage plan, the same insurance. They were able to switch it to that state's plan. But when you have that Advantage plan, there are networks. So when she was choosing a physician, a primary care physician, we had to make sure that they were in network with her and Medicare Advantage plan. So it's not that you can just pick anyone. If you have a Medicare Advantage plan, you have to find out who is in coverage. Now, all the Advantage plans, let's take a national one, say like Aetna. You can go onto the Aetna site, put in the state, put in the zip code. It will come up. You can check to see who is in network with you as you're looking. The website for your insurance, your Medicare Advantage plan, that's another great resource for you to be able to use as you're trying to find services in your new state. So you want to make it a priority to contact your plan provider before you move if possible. In this instance with our client, I mean, the move was not planned. It was all of a sudden and it was unexpected. So we had to do some scurrying and some hurrying to get things in place. But, many insurance companies, they have dedicated teams that are available to be able to help you with the process. So just want to reach out and ask anyone, have you ever had an experience switching Medicare Advantage plans or Part B coverage after a move? If you have any helpful tips, anything that you came across that was especially beneficial with you, please, if you feel comfortable, share those in the comments so that everyone can take advantage of your wisdom. Okay, so we're going to go on to number 2, and that's finding new healthcare providers. Again, we looked at the Medicare site. Let me bring that back up again for a minute. And let's go to Welcome to Medicare. And here we go again, finding care providers. So if you click on that, find providers near me. And it asks you, what are you looking for? Are you looking for doctors, clinicians, hospitals, nursing home, home health, hospice, anything that you are looking for? You can find that. So there's more learning about the tool. So if you click on, say, doctors and clinicians, where do you live? And then if there's a group that you're looking for, and this will also help you. Now, there are some sites out there that can actually help you find a doctor. So it's called ZocDoc, and it's just ZocDoc.com, and I'll put that in there. It's ZocDoc.com, and this is kind of a neat tool. And so ZocDoc, that's kind of a neat tool. It also will help you look at what is covered by your insurance. So they add another layer to that. So that's kind of a neat website. It's not all inclusive. I've had some people have really good luck with it. I've had some people say that it hasn't been super helpful. But again, it's another tool in the toolbox, and it's another resource that you can try. So let's continue on with that. And I just want to say, yes, it is pretty easy to do. So thank you for the comments. I appreciate everyone that's tuning in and watching. And if you are catching this on the replay, I just want to say we appreciate you as well. So let's move on. So we talked about the Medicare Physician Compare tool on Medicare.gov. Here you can find doctors near your home, as we were just showing you. And you want to double check the reviews, the ratings, find someone that feels right for, feels like a good fit. And this is something that a lot of people don't know. You can schedule a consultation with a doctor. Doesn't mean that you're taking them on. You can just book an appointment with a doctor, and you want to book it as a consultation, and you ask the doctor questions. What are your philosophies? Ask them questions, ask, maybe if you like them, if they're more aggressive or if they're more laid back. Do they, like to prescribe medicines? Do they like to try some, more holistic things first? It's kind of an interview process for you and the doctor, and to see if it's a good fit for you, because, they're playing an important part. And as we get older, we rely more on doctors and clinics and things like that as we get older and our healthcare needs change. So it's perfectly okay to sit down and interview a doctor that you're considering to take over your care. So, if anyone has used the Physicians Compare tool before, again, feel free to put a comment in there. And literally, we're building a toolkit for our community as we speak. So, number 3 is we have state-specific healthcare programs. So here's something important to keep in mind. States can differ a lot when it comes to healthcare programs. For example, Medicaid eligibility, services can vary by state. Even if you're already enrolled in Medicaid, you will have to reapply in your new state. It's definitely a headache, but it's required. So just want to let everybody know, some states offer additional healthcare resources for seniors beyond Medicaid, like programs that assist with home care, transportation, medications. So every state, every county in every state has a government agency dedicated to serving the aging population. Now, here in Wisconsin, it's called the Aging and Disability Resource Center, or ADRC. In other states and counties, it may be called something else. If you're unaware or you can't find them, you can do a search, aging services in Monroe County, Wisconsin. And that office, that government office, should come up. So if you know the county and you know the state, you should be able to locate this resource in your new state. Now, we like to send people to this resource because they are the keeper of all the resources in your county. If you want to know about support groups, transportation, services, home care services, things like that, they are the keeper. They have a booklet of services, Meals on Wheels, all of these things you can get from the new state that you're going to by contacting that office on aging. So these terms, they're don't hesitate to ask questions when you call. Sometimes these terms, they're here to guide you, and knowing all the possibility or knowing all the options ensures that your loved one receives the best care. And so I don't know what every state and every county calls it, but they do have an agency, I assure you. So just reach out and ask, and they will be able to steer you in the right place. Again, if when in doubt, just contact a local health department. They'll be able to provide you the information with the government office on aging. So number 4 is the last thing that we want to focus on doing is really ensuring continuity of care. And what does that mean? Just making sure there's no gaps, that there's nothing falls through the cracks. And so we talked about the ADRC as those new resources, or the aging office in your county. So that will help, maybe transition those states. Now, if you were receiving Medicaid, say here in Wisconsin, and you were moving, say, to Kansas, there may be a wait period, there may not. But again, like we said, there may be different qualifications that you'll have to meet for a different state. So here's something we don't want you to overlook, is ensuring that smooth transition so that there's absolutely no break in care. So the main thing is, before you move, request copies of your medical records from your current providers before you move. You can, by simply filling out a form or release of information, you can request copies of your medical records, your medication list, your history and physical, recent vital signs, any pertinent surgeries or injuries that you've had. Because I'll be honest with you, not all EMRs. And what is an EMR? An EMR is an electronic medical records. Every hospital clinic uses them, but they don't all talk to each other. So if you're in Wisconsin and you go to California, and the healthcare system, say someone is using Epic in Wisconsin, they may be using something else in California, and all they may be able to see is some very, very basic information. So it's really a misnomer when we think that our medical records are all stored online, that everybody has access to it. It may not. You may end up in an emergency room in your new state, and if you don't have your records and they can't access it and you're unable to share information, they're really treating you blind. So it's really important. A good friend of ours, Barbara Gaynor, she is also an advocate. She does a really nice workshop on building a medical binder. And that's something that's really good, is to just keep that with you. Once you have all those records, you can keep everything in a binder, and you can take that with you. And it's very, very, very helpful, especially when you move or when you travel. So that is basically the four things. And so, if you or your loved one takes medications, reach out to your pharmacy. This is another thing where we could fall through the cracks. When you're moving and you're going from state, especially you have a Medicare Advantage plan, those pharmacies are, under a network. You can only go to them. You may not be able to access a pharmacy in a new state with your old plan. So you want to make sure that before you move, that you have your prescriptions refilled, you have a good month's supply or 3 months supply, so that you can make this change and make this transition without having any gaps or loss in medication, so that you don't miss any of your refills. So I'm going to ask a question. What's one thing you plan to do before moving to make sure your transitions are smooth? If you are an aging adult or an adult child of an aging parent or grandparent, and they're preparing a move, what's one thing that you know already after listening to that you're going to make sure that you do prior to their move? So I know this was a lot of information, but here's the bottom line. Moving can be stressful, but with a little planning, you can make sure your loved one has everything in place for a smooth transition. We don't want any lapse in coverage. From updating Medicare and Medicaid, Social Security checks with direct deposit, finding new doctors, transferring records, making sure that your medications are taken care of. Each step ensures your healthcare needs are met without disruption in your care. So before we wrap up, if you've got any specific questions, drop them in the comments now. I'll stick around for a minute to answer as many as I can. And remember, if you found today's tips helpful, hit the like button, share the video. We're going to have the replay. Also, we will list that in a couple days when we get that recorded. It's always going to be placed on our YouTube channel. It's just Your Nurse Advocate Consulting on YouTube. So you can find it here on our Facebook page or also on our YouTube channel. And just remember, you're not alone in this. Plus, don't forget to follow this page for more Tuesday tips. We do this every Tuesday, and we have a lot of resources to help you and your aging loved one thrive. So until next week, take care, be kind to yourself. And those of you that caring for an aging loved one, you're doing a great job. Just keep up the good work, and it truly is a labor of love. So with that being said, we're going to go ahead and we're going to wrap up another Tuesday tips. Take care, and we'll see you back soon.